Hello, my name is Dr. Bob DeMaria, the drugless doctor, and today we're going to talk about blood pressure. I know thousands of you watch me right now have high blood pressure, and you don't know what to do about it. There are so many causes for your blood pressure to be high, but let me briefly tell you about blood pressure itself. The 120 number, that's the amount of pressure that your ventricle, which is a part of your heart, has to push blood through the rest of your body. If you're overweight right now, for every pound that you're overweight, it adds 200 miles of extra blood vessels. That means your ventricle, or that pump, has to push harder. Some of you just need to lose a few pounds. Then when the blood comes back into the heart, which is called the diastolic blood pressure, that's the amount of blood that forces against the heart wall. And what I've found from my experience, a lot of times you might need some potassium. Potassium promotes optimal heart function. Now, there are so many other possibilities for high blood pressure. One of them happens to be, from my experience, a vitamin D need. You know, vitamin D helps promote optimal blood pressure. I personally take between 4,000 and 6,000 units of vitamin D every day. But I don't want you just to go out and start taking vitamin D. It's probably wise to have your healthcare provider have a D3 blood test done. The reason is that everybody has different levels. But from my experience, most people have a vitamin D level of 20 or less. And if you happen to have dark skin, I have found from my practice, and I've been practicing since 1978, people with dark skin almost always have low vitamin D levels. So please talk to your healthcare provider first before you decide to go on any type of program with vitamin D, which does promote blood pressure normalization. These are collard greens. You say, Dr. Bob, what do collard greens have to do with blood pressure? Well, I want you to know that collard greens are a great source of chlorophyll, and chlorophyll is loaded with magnesium. And what I've learned from my experience is that magnesium promotes optimal bowel function. Usually I have our patients take 4 or 5 magnesium right before they go to bed, or until bowel tolerance. But you know what I really want you to do? I want you to start eating some greens. These are collard greens. You could eat kale. You could eat romaine lettuce. But you want to help improve your diet. Let food be your medicine, and let medicine be your food. Some of you, this is salt, are consuming too many products that have high sodium levels in it. And sodium causes water retention. And water retention puts a demand on your heart muscle. So be aware of the amount of sodium in the ingredients that you're consuming. Maybe start cooking at home instead of going out to restaurants that sometimes you don't know how much sodium is in the products that you're consuming. So let me give you some drugless action steps. Number 1, start adding some green food to your diet. Get out in the sunshine. It's a natural source of vitamin D, which helps promote optimal blood pressure. And then finally, make the wise decision to become calorie conscious, reduce the amount of calories you're taking in, and guess what? You're going to lose weight and your heart doesn't have to work so hard. I'm Dr. Bob DeMaria, the drugless doctor.